Hello everybody, my name's Rob. I'm Chief Exec of South West Yorkshire Partnership NHS Foundation Trust, and I'm also the lead Chief Exec for our Health and Care Partnership. So this is a partnership that brings together all of the councils, all of the NHS organisations, all of the third sector organisations like charities and community interest companies, and communities themselves to try and make the biggest difference that we can to people in West Yorkshire and in Harrogate. And our work really is driven by the need to improve outcomes for people. During the pandemic, which we've now been in for about a year, we've been prioritising what we focus our efforts on. And in the first wave, we said, there are 4 things that are really important right now. The first is to make sure we've got hospital beds for people who really need them, particularly around intensive care and ventilation and oxygen. The second was to make sure that people were being cared for in the community where they needed to be. Third was that people who were vulnerable and shielding got support. And we thought at the time there might be about 100,000 people who needed that kind of support. And the fourth was to make sure that we were working together to provide mutual aid where there might be stresses or pressures on things and the situation was changing. Now, over that whole year, those priorities have changed slightly, but the one around supporting people in communities who are shielding has never gone away. It's always been one of the things that we've done, even when shielding hasn't been a thing, when the government has decided not to have shielding. So today is a really fantastic opportunity for people like me to hear what the experience has been like for people who've been shielding and their families. And I think it's essential that we hear what people have got to say. I think one of our jobs as leaders is to bring seldom heard voices out, so that the views of folk inform what we do. And as a partnership, that's one of our founding principles, really, that we try and make sure the people are in the room when we're having the conversation and when we're making decisions. So my job today, really, I think Rachael said that I'm the keynote listener. So rather than be the keynote speaker wherever I see, listen to me spout on for 20 minutes about stuff, I'm really here to listen to the session today, and then I'll do a bit of feedback at the end. But I'm really looking forward to hearing what people have got to tell us, really, so that we can make our system work better for the people who we're really here for. So thank you for letting me join you, and thank you for sharing your stories.
Thanks, Rob. So my name is Rachael Loftus. I work for Rob in the West Yorkshire and Harrogate Health and Care Partnership, but I also work for the City of Leeds, and I've had the privilege to be the shielding lead for that, and I describe that as saying it's my job to help people to be able to follow the advice that will help save their lives and stop them getting unwell. And so we've been trying to listen to people telling us what they need in order to follow that advice, and I work with similar people, Imran, Sarah, Steve, Dave, Pam from Bradford, Calderdale, Kirklees, Leeds and Wakefield around the place to do a similar job. We thought it was really important today, because we've all been in a really privileged position to hear directly from people and to listen to them, that we share that with our colleagues who work across West Yorkshire. So I think we've established now, so we've got in terms of this is being recorded, so please only share things that you want to have shared and recorded forevermore. We've turned off the video for everybody who's not presenting for this part of the session, and then we'll be able to turn them on later. If you've got a question, what we've said is use the chat, but if you've got a question and you can't use the chat, just come off mute and intervene. We should be able to manage that, I think, between us to do that. And yeah, if you could stay on mute, because obviously, as we know, you can hear lots of things, including children and pets and all the things that we live with in our working life these days. So I think that's our session, and without further ado, I'm going to introduce you to Connie and to Annette. Yeah. So I was just going to begin by asking, I'll ask Connie first and then Annette, just tell us a bit more about you and how you approached the last year.
Shall I go first?
Yeah.
Okay, Annette. Yeah, well, I'm one of the clinically extremely vulnerable people. I'm a carer of an extremely vulnerable person, and I've been shielding on and off since late March last year. And as an ex-runner, I feel like I'm on a marathon and the finish line is somewhere within my eyesight now, where I'm really sort of struggling in this last few miles, and I think I've hit the wall more than once or twice. So I'm having to dig in there and try to keep going. From a personal perspective, although I'm not ill all the time, I do have ongoing underlying serious health conditions that make me very frightened about catching COVID, although that's been lifted a little bit by having actually had my first jab last week. So that's been such a positive experience, and although at the moment it's not going to make any immediate difference to my to kind of me personally and to my mental health, it's been a real boost. So I'm eternally grateful for being able to have that, and I feel very privileged and very hopeful that it's going to make a difference. My daughter's still waiting to have the invitation for her jab, but that might be because although she's in the same group as me, she's much younger than me. She's only just 40, and I'm nearly 70. So I think that's probably how it's filtering through, that maybe older, clinically extremely vulnerable people are being selected first. I don't know how it works, but anyway. So you wanted to know a little bit what it's been like for me. It's been an extremely long 10 months, and it's been very, very challenging, mostly emotionally and mentally more than physically. I've at times felt very isolated, even though I live with my husband and my daughter, because I'm isolated from my family, from my friends, from all the things that I knew when I did. And I was a volunteer as well with older people, and volunteering was a big part of my life, and gave me a lot of friendship, support, a purpose. So I've lost all those things as well, and they're really, really important things when you're at home that you need, because I'm not working, so I don't have that to drive me. So to keep yourself motivated all that time is extremely hard. I started off like lots of people did. I was baking, I was crafting, I was doing X, Y, and Z, and now I've got to the end of the alphabet almost, and it's like, what can I do now? And I've found as the months have gone on, and I don't know if Annette will feel the same, my kind of ability to concentrate on things has really dropped off. I literally flip from one activity to another. So during the day, I might do a Zoom with somebody, I might do a little bit of knitting, some reading, cleaning. I must have the cleanest house in Leeds by now. I'd have stripped it bare if I could have gone to the tip and got rid of stuff, but I can't. So my husband's eternally grateful for that. So I think really I'm just running out of steam now, and I can't wait for it to end for all the same reasons that all of you people do, but just because I need to be able to have a purpose and a function and move on. But can I say, I live in Leeds, and for me as a Leeds person, I feel like I've been very, very well supported by my city council. And in fact, just yesterday, because of the weather, and I must read this out because this really, really made me feel very, very happy. And this was dated yesterday, and it said, "We know today's extreme weather may have prevented grocery deliveries getting through to some parts of the city. If you don't have enough food for the next 48 hours, please call and let us know. We'll try and arrange an emergency delivery for you as soon as weather permits. And if you need practical or emotional assistance, call us on." And you know, it nearly made me cry yesterday, because I thought, yeah, even at this, this far end of everything, people do care and they are bothered. And so that was really, really important. I don't really know that I can say much more about how I feel about things, because it hasn't changed from probably last time people heard me talk. Just to say, it's a very isolating experience, and at times I've been very upset by things that are being said and happened in the press. So, for example, a couple of weeks ago, there was a little thing on TV where people were saying, well, teachers and policemen and that should get the jab now, you know, and the person being asked was asked by the interviewer. Well, to do that would mean we'd have to exclude some other groups of people because there isn't enough vaccines at the moment. So who do you think we could leave out? Who could we miss out in order to give those other people a vaccine? And guess which was the first group that came up? All the clinically extremely vulnerable, because they're already in their homes, you know, they're not doing anything anyway. So just give them a few more months inside and you think, flipping heck, you know, we're people, we've got lives, we've got roles, we're workers, we're carers, we're parents, we're siblings, we're brothers, we're sisters. You know, why? I felt like I was being picked on. It's already hard enough because I have to stay in, and I have stayed in, and I've been very, very strict about that. And then for somebody to flippantly say, well, a few more months isn't going to make any difference to that group of people. I think if I could have physically got to that person, I'd have wanted to slap her around the face. And I'm not a violent person.
I was going to say, Connie, now I know you're not a violent person, but we should probably stress that for anyone else, anyone else listening.
But you know, the kind of feelings that you develop because you are in the house. You know, I've started to become a person that I don't like and I don't recognise, and that's not nice.
No.
I've started to be resentful and angry and jealous, and they're not nice feelings, and I don't want to feel like that. I want to be the happy person that people know me for, you know, somebody they can turn to. So that's what I want to see an end of. So I'm going to finish on saying having the vaccine was such a boost, really made me feel very blessed, and that yes, I do count, and people do want me to be safe and want me to be able to move on. And to Leeds City Council for all their offers of care and help, even though I've not needed to take them up, I know they've been there. And that little text message yesterday was just like, yeah, really brought it home to me that, yeah. So I keep messages like that, and when I get really upset down times, I go back and I have a look and I think, yeah, it's not all bad. Anyway, I'll let Annette say her bit now.
Oh,
thank you, everyone.
Thank you, Connie. And honestly, your honesty, I absolutely know will resonate with so many people on this call. And so thank you. And beyond this call, it's so important to do that. Annette, tell us a bit more about you and how you've been approaching the last year.
Yeah, that was really nice to listen to Connie there. And I do resonate with a lot of what she's saying. But my perspective, I'm Annette, and I work Voluntary Action Leeds as a project worker, and I work with communities predominantly. So I've been isolating. I'm in the clinically extremely vulnerable group. I've had autoimmune condition for over 20 years, and so I've always known that I fall into that category. So when the time came, I knew I was going to be one of those people who would be locked down. But I had my job, so my job was super busy during the very first stages of the lockdown. So from March, when we first got locked down, our work changed because we were responding to communities and COVID and everything was going on. So it was a real crazy, mad period of time where I didn't have a minute to relax or think about myself or anything really. It just felt like work, but it was good for me because it meant I didn't have to focus on the fact that I couldn't go anywhere. I couldn't even go to the shops, couldn't do anything like that because I was busy doing my job. And the fact that my job was supporting other people, so the communities that we were helping, you know, I was part of getting the cultural food hub set up because of the work I was doing with communities and feeding that information back into the council. So it was really, really rewarding during that time. So I didn't feel the burden of being under lockdown as much as probably Connie might have felt it. So because I had the work to do, and that really did keep me focused. But I think I was really looking forward to the sort of uplift in August, when we could go out, because my mum is also clinically extremely vulnerable and is a carer as well. And I was in a bubble with my mum, so I was really, really keen to be able to take my mum to the shops or take her to the bank or do things like that, because I really missed that physical connection with people. And I realised it sort of halfway in to the lockdown, that's a big part of my life, and it did make me feel a little bit down sometimes. I felt, just like lost the sort of that mojo at times when work was over, and then it was the evening, and then what do I do now? Just going from one room to the next. What I did used to do to try and break up the monotony is I'd have work in one area of the house that was my office space, and then when I'd finished, I would leave that room and not return back to that room for the rest of the day. I'd go in another room and spend the rest of the evening in that other room, which kind of broke up the monotony and made it feel as though, yeah, I'm in a totally different space now. Like I've come on from work and now I'm home. So it helped to, just sort of make it manageable, just to make it more manageable, because it was just the sameness, constant sameness. The third lockdown, I think that one affected me the most. So when they announced this one that we're in at the moment, I felt really down, so suddenly just felt like hopeless, like all was lost, and that there was, when is it going to end? And I felt a little bit like the hope has gone out of me, and that feeling that when is it ever going to stop? And that fear as well for me, I recognise what Connie was saying when she said that the fear, because of the condition I have, I had a fear of being out and going around other people, and that fear of contracting anything that would have made me ill, because I know how it would have affected me. So that in itself was always just hanging over, sort of just that dark cloud hanging over me. But obviously, I think that for me, as time has gone on, I think it's just become taking every day as it comes. And also, I suppose what has kept me going, like I said, was my job. I started a second job during the lockdown, and I was really excited about that as well. So I'm doing 2 jobs at the moment. That's kept me even busier, and it's meant that as well that I've been able to actually realize my skills. That I have a lot of skills that I suppose I don't think about. So I've recognized I have a great ability to keep myself occupied. I'm able to be on my own, so I can spend time by myself, and it doesn't, and I actually do like myself. And sometimes I don't even think about those things until being in the lockdown, and I did enjoy my own company. I enjoyed the freedom of being at home and sort of managing my work day as opposed to my normal day. I enjoyed that independence, I suppose, really. There was a little bit of pressure, I think, as well to be back in the office environment at some point, but I felt really strongly about the fact that I wasn't ready. So, and because of my fear, I didn't feel ready to do that. So luckily my work were understanding, so they didn't force me to come back in. So I've not actually been back in the office since March. I've done all of my work from home, but I have achieved so much, and I think that also my work ethic has improved drastically, because as Rachael was saying earlier, you could do so much in 4 minutes. There's so much more you can do in your own time whilst at work in your home, that I feel I've achieved such a lot in that time, and been quite successful at my job. So I do feel, on the one hand, yeah, the lockdown has been tiring and a bit of a drain, but I've been busy, and I've felt kind of privileged and lucky that I've had that, and I've been able to work, because I think if I didn't have that, I think I would have gone out of my mind, because I totally empathise with Connie, that sometimes that feeling of isolation and feeling as though there's nowhere, because my children are all grown up, so they've all left home, so there's just me and my partner, and sometimes he's not here because he's got to work as well. So I'm on my own for long periods of time with no visitors and nothing. So yeah, I think it's been an eye-opener, but I have learned a lot about myself, and I feel going forward, pray that it's all going to get better. And I've had my invitation to go and get the vaccine, which I'm going to get tomorrow. So
fantastic.
that's a start.
I think they're really inspirational words there, which is, and the one I'm going to take away is, you know, I really quite like myself. I think that just the authenticity that you're saying there, I think is really inspirational, and thank you for that too. Now, because I could listen to you guys speak all day, I am going to try and move us on, but there's one question I'm going to ask you for just the shortest possible answer you can give, which is, you're speaking now to lots of people who work across all different aspects of the health and care system. So is there one thing that you would like them to hear most from your experience that you think that you think they should take away from this? I'll go to Connie first and then come back to Annette.
Keep us at the front of your thoughts, and remember, we do matter. We are important. We're quite a big, diverse group of people from all sorts of backgrounds and age groups. So just remember us, and fight on our behalf, because often we don't have the space or the forum to make our voices heard. So we depend on people like you to do that for us. That's what I'd like to say.
Thank you. Annette?
Yeah, I think I would echo some of what Connie said there about keeping us in the forefront, not forgetting, because we might be in that clinically vulnerable, extremely vulnerable group of people, we still have value, and we still, can contribute to society in the same way everybody else can. So to not put us on the back burner or at the bottom of the list, but include us in everything going forward, and remember, that we can't help the situation that we're in. It is what it is. Fantastic.
Thank you so much. And you two, you've given us such a diversity of your experience, but I think, I always say this, but as of this morning, there were 102,561 people who live in West Yorkshire who are clinically extremely vulnerable, and that means we've got as many stories as that. And I think the depth that you've given us today is really valuable, but we'll never forget that there's a lot more stories, and hopefully we'll get time to hear from some of the people on the call as well. So I'm going to hand over to Dave, who's going to introduce the work that we've been involved in around getting an academic perspective on what it's like for people who've been shielding.
Thanks, Rachel. I just wanted to echo everybody's comments in the chat box around how inspirational Annette and Connie were there. It was fantastic, and that was one of the reasons that we so feedback like that was one of the reasons that we wanted to do what I'm going to go through now and pass on to Anne in a moment. So my name's Dave Thompson, and I chair the Clinically Extremely Vulnerable Board at Kirklees. I'm head of access for the council. As the first lockdown was coming to an end, the board decided it would be useful to do some research into how we had supported those shielding, so that we could make plans for any future support. And as we know, that future support has escalated and escalated and escalated over the last few months. We have a world-renowned, sorry about this, Anne, I'm building you up here. We have a world-renowned university in Huddersfield, which is our main town in Kirklees, for those of you that don't know. So we approached the university to undertake that research. And I'd like to introduce you to Professor Ann-Louise from the university. Professor Caress will now take you through some of that research for you.
Hi, thank you very much. Thanks for your introduction, Dave. This is where I demonstrate that almost 12 months of lockdown hasn't made me any more competent with IT. So there we go. Can everybody see my screen now? Is that visible to everyone? Rachel, is my screen visible?
I can see it. Yeah.
Yeah, good, yeah. Fantastic. That's really helpful. So thanks so much for asking me to share. This is the first public outing actually of these data. We're just in the process of analysing our data at the minute. So thank you from a personal perspective on behalf of the team and on behalf of the university. For those of you who don't know it, the building behind me is the Ramsden building, which is where I work. It's the university's oldest building, and it's kind of nice to see it there, because it's the first time in months. I've not set foot in it since March. last year, so it's kind of nice to see it. So what I'm going to talk you through today is findings from a study that we undertook. The data were collected from early May to the end of July last year, so it really covers primarily the first lockdown and kind of moving into the summer. We've not been back to the participants, but we are going to do some qualitative work. We've got one qualitative sub-study with people with rheumatoid arthritis that was started a little while ago, and we're hoping to do a number of other sort of qualitative sub-studies with some of the people. And although I'm badged as an expert in shielding, of course I'm not, but what we did have is 1,423 experts in living with shielding and 383 members of families of those who really were the people with the expertise in you know what it's like to live through this experience. We recruited them through 14 UK-wide charities and one specialist cancer hospital. We did originally have 15 charities and 2 other hospitals on board, but unfortunately, because the ethics and governance process takes so long, they weren't actually able to recruit before we'd had to close the survey. So what I'm going to do today is focus on some of the very early data we've got from just 2 groups, and that's people with kidney problems and with cystic fibrosis. They're quite contrasting in that within the kidney problems group, you've got a large group of people who've had a transplant, so are vulnerable because their immune system is suppressed. For another group of people with kidney problems, they were having to break shielding to go for dialysis. And I hear from one of the charities that there has been a high proportion of people who've been going for in-centre dialysis who've sadly contracted COVID and passed away, and that actually includes my elderly neighbour's son that had that experience, unfortunately. And then people with cystic fibrosis, because of their condition, they kind of almost have to shield most of the time anyway. They can't mix in groups. It's difficult for them to go out to the cinema and so shielding was almost an extension for them of what they already had to do. And kind of one of the challenges there was that it almost foregrounded their condition. And for many of them, that was quite challenging because they're used to being quite independent. Many of them, obviously, they've all had the condition since birth. So many of them are kind of very independent. The age group is also very different. So the cystic fibrosis population is overall younger, whereas the renal population is sort of overall, it covers all ages, but overall it's a middle-aged to older population. So some differences in the experiences.
Definition of represent.
Sorry, can I just say, Natasha, have you got your hand up? Natasha, did you want to ask a question?
It wasn't a question. It's more of I'll say it at the end. It's more of a story that I would like to share.
Yeah, okay, that's great. We'll come to you. We'll go back to Ann-Louise for now, and then when we've had the other presentations, we're going to have an opportunity for you to speak. Thank you.
It's more that my experience that is sort of a question involved in it.
Yeah, okay. Are you okay for us to come to you at the end of the presentation?
Yeah, sorry.
That's okay, good, thank you. Sorry, Ann-Louise.
No problem, no problem at all. So these are a few headlines. I apologise for the slightly busy slide. It was quite a long questionnaire, probably too long, as my statistician would tell me, because we were trying to ask as much as we could. So these are some of the headlines. Most people across the sample, and including in these 2 subgroups, thought shielding was necessary for them. There were some aspects of it, though, that were particularly difficult. Individual experiences were very varied, but across the entire sample, anything that required maintaining physical distance or isolating inside the home was really difficult for people, either because it was logistically difficult or because it was emotionally difficult. Also, mood and physical activity levels. I'll share with you a little bit more data about mood in a minute, but keeping physical activity levels, people found really difficult. Information of course, we were collecting data fairly close to the beginning of the first lockdown, and there'd been a lot of to-ing and fro-ing about who was clinically extremely vulnerable, and people were getting shielding letters at quite different times, and many people had started shielding before they got the letter because their clinical teams had told them, or because they decided themselves they felt vulnerable. So information people found was often inadequate and a bit too late. Overall, however, across the sample, people were more satisfied than dissatisfied with the support they'd received. But food parcels were quite challenging because both of these two groups, people with kidney problems and people with cystic fibrosis, have very particular dietary needs. And their experiences were that the food parcels tended to be kind of processed and often unhealthy food for good reason, because you can't be putting fresh food necessarily in these parcels. But also they were too high in salt or maybe too low in calories for people with particular dietary needs. So that's perhaps a learning area. People had generally kind of tailored their shielding a little bit. So there were some aspects that people had decided they weren't going to completely follow, and I'll share a little bit of data about those, I think, in a minute or two. If they had to recommend shielding, of course, at that point, when we were looking at kind of up to the end of July, we hadn't gone into lockdown 2, let alone lockdown 3. Most of the samples said yes, they would, but reluctantly. And quite a number of people were sort of saying it would really, really hit me. It would really affect my mental health if I had to do it again. But again, a lot of people were saying, but if I did do it again, I would nuance it, I would individualize it, I wouldn't go, for this sort of blanket approach that was suggested before. And for some individuals, they just simply wouldn't have been able to do it again because they had to go back to work, the financial pressures were too much, or they had caring responsibilities that had prevented them shielding, or they'd been able to sort of put on hold but couldn't keep doing it forever. And in terms of how long shielding should continue, the majority of people said until there's been a marked reduction in cases and deaths from COVID. And I'll present you some more detailed information about that in a minute or two. So this gives you some idea of the impact on mood. As you can see here, that kind of half of the people with kidney problems and similarly, actually a higher proportion of those with cystic fibrosis found their mood was worse during shielding than it had been before. It was kind of interesting that we did see a difference between the people with CF and the people with kidney problems. That may reflect the age, because we know that younger people have tended to be, their moods tended to be more severely affected. It may also just be an artifact of one sample being a bit bigger than the other. In terms of aspects that people chose consciously not to follow, again, a bit of a difference between the people with kidney problems and the people with cystic fibrosis. I suspect, although I can't say for sure, that that's because the people with cystic fibrosis are, as I said before, kind of used to living almost with shielding, so maybe felt they could take a few more risks, felt a bit safer, kind of stretching the limits. But the sorts of things that people were choosing not to do was not staying at home. They were going out for a walk, and for some of them it was just because that their mental health wouldn't have coped if they hadn't had the opportunity to just go out of the house for a while. Some had no choice because they had, for example, caring responsibilities. Some, as I've said before, found it really difficult to physically isolate within the home because their domestic circumstances just made it impracticable. The one that really worries me is this one where someone was saying here that I was meeting with others as they were well. There were some individuals who didn't necessarily fully appreciate the risks that may have entailed for them. And this one hopefully will make a few people on the call smile, because this is about the satisfaction with support from the local authority. And you can see here that more people were satisfied than were dissatisfied with that support. And that was generally true of most of the other sources like the NHS and voluntary organisations. And here's a little bit of data about the exit strategy. You can see here in both groups, the vast majority feel that shielding should continue until we've got a marked reduction in cases and deaths. The vaccine, of course, is playing in. When we were collecting these data, the vaccine was a little bit off on the horizon. So I suspect if we repeated the study, we'd find the vaccines would kind of come a little bit higher. But very, very few people were kind of saying, as you can see, a tiny, tiny proportion saying we should just be treated the same as everybody else. There was a recognition that shielding is something that much though people didn't like it, they felt needed to be around, and the support was needed. And I have to say, I mean, something that people may or may not know, the UK's approach to shielding has been quite different from that of many other countries. If anyone wants to chat a bit more about that, I can happily share a bit more of that. But our approach in terms of the support we provided and that central provision of support has been very, very different. So that's something I know that people in government are looking at kind of, you know, well, if we did it again, would we do it the same way, or would we follow perhaps the Canada model or whatever? So I think these kind of data are really important from that point of view. So at this point, I just want to thank all the different organisations that supported us, and all, of course, the people from those organisations who took part in the study, and my own university for allowing us. We did this without funding. We applied for funding, but sadly didn't get it. So they kind of gave us the support to get on and do the work. And if anyone does want to get in touch with me, those are my contact details. I'll happily share those. I'll put my email in the chat as well if anybody wants it. So thank you very much. And hopefully I've kept to time.
Thank you. You've been very good, because we were a bit late starting, so I'm anxiously watching the clock at this point. But that's really helpful. And I think we should say as well, people have asked about the slides. We are going to send out, and I think Ann-Louise did prepare a much longer slide deck as well, that's got those slides and some more information in as well that I just think is really interesting. So without further ado, I'm going to pass over to Hannah.
Rachel. Hi, my name's Hannah Davies, and I'm Chief Exec at Healthwatch Leeds. And like Anne, I'm not here as an expert on shielding, but I'm here to share the experiences of the people who've been shielding, of what they've said to us over the past 10 months. For those that don't know about Healthwatch, there's a Healthwatch in every local authority area, and our role is to listen to people's experiences, develop themes, and take that to health and care decision makers in our local area. During COVID, when COVID arrived, we absolutely recognised that we wanted people's voices to be at the centre of the planning for health and care services during COVID. Sorry, next slide, please. Within Leeds already, we had a group called the People's Voices Group, and that's a group that brings together all the people whose job it is to hear the people of Leeds from the different health and care organisations. So our hospital, our community health organisation LCH, the council, third sector, mental health trust, and others. So before COVID, we were working together to make sure that we were listening to the people of Leeds. And as a group, we linked directly to our health and wellbeing board. And our ambition, a bit like Rob mentioned at the beginning, is to put people's voices, especially those with the greatest health inequalities, at the centre of health and care decision making in Leeds. And we worked this model just on the top right of the slide, if you can see it, is that we believe that people with lived experience should be heard in all parts of the health and care decision making process. Next slide, please. So at the beginning of COVID, we thought, right, how can we make sure that we're hearing people's voices, particularly as we couldn't do what we would normally do, which is go out and talk to people. So we designed a new listening programme called the Weekly Check-In, and that was, it had two elements to it. One was an online survey where we just asked 3 simple questions around key themes that people were experiencing during COVID. And then the other bit was really important because we didn't want to miss the voice of inequalities, because that absolutely is the voice that we need to hear. So we worked with our third sector partners, including organisations like Annette's at Voluntary Action Leeds, and spoke with them on a weekly basis to hear about what the experiences of those communities were. And we asked key questions around things like how were people's mental health, how were people finding the move to digital, and lots of other stories. And all those reports, every week we would produce a report, and all those reports are on our website. Next slide, please. So in terms of hearing people from shielding experience, I should say Healthwatch's role all the time, we're out there listening to people, but this is just particularly related to the weekly check-in. We did a specific shielding survey in June, so similar time to when Anne was doing her work actually. And we heard from, in 1 week, we heard from 560 people who'd been shielding on an online survey. And then, as I say, we spoke to our third sector partners and community organisations to understand how those different organisations, sorry, those different communities were finding it as well. We've also done a little bit of, I picked up another, through the weekly check-in, some more intelligence in September. And at the moment, we've got a survey out as well, asking people around their mental health, not just how their mental health's been impacted, but also how they're finding it accessing mental health services. Next slide, please. So many of the things that that we heard are things that Connie and Annette and Anne have described already. I think, as with much of the work that we do at Healthwatch, communication is often one of the key themes that people talk to us about, but it's really profound in the experience of shielders, particularly at the beginning, as Anne and Connie and others have mentioned. There's just a few quotes for people here. As Anne mentioned, information arrived late, the messages were sort of conflicted. I spoke to somebody actually, someone kindly shared their story with me last week as well. And this lady has actually, she's been shielding and actually been almost in her room for nearly a year now. So, you know, again, a really intense shielding experience. But she talked about how at the beginning, and I don't think this came from Leeds, I think this was a different local authority area, but she'd received a text saying that she should pack her bags ready for the hospital. And what she heard from that was she should pack her bags because her life was soon to end. So, you know, I think one of the key messages that we were giving at the time, and we would sort of reflect on, was the absolute importance of how we communicate with people over this time, which is important at any time, but particularly for people who are so isolated. And that those communications should be compassionate as well. That, you know, I think the example that Connie gave yesterday was absolutely brilliant about how it made her feel cared and looked after and supported by that caring and compassionate communications. I think from a Healthwatch perspective, we would say how we communicate with people is as important as any other element of any care pathway. So it's as important as a blood test, or as important as any other sort of medical need. How we communicate with people. Next slide, please. Oh, actually, I should have mentioned in that also, and I don't know if anybody else has mentioned that, and it's sort of a bit old now, but the actual term of being identified as vulnerable, and the term shielding as well. You know, those terms in themselves were not kind and compassionate language. And didn't speak to a lot of people. I say that I'm not an expert, but actually I received a shielding letter as well, because I've got an autoimmune condition, and I have to say it impacted me quite a lot, hearing that I was suddenly being identified as vulnerable. So just highlighting the importance of language and how we speak with people. Another theme that we heard as well was around isolation, and again that's such a strong theme, but cannot be underestimated, the isolation that some people have experienced. And as I mentioned, I spoke with someone last week, and literally they had this person had been in their room isolating from their own family as well. They had children out at schools, you know, for nearly a year, and the impact on that person's mental health and self-worth and self-confidence was significant. And again, another theme that we heard, which Connie mentioned, was feeling forgotten and locked out of wider society, which is again really important for us as well, a society and health and care organisations to understand. Next slide, please. Other concerns included access to food supplies, suspension of health services, money and finances, fears of catching the virus has been mentioned. We also asked people what they could be done to help them if shielding was extended. And this is just some of the things that people talked about, but you know, important messages around peer support, being able to talk to people. The person that I spoke to last week was just happy to talk to somebody about her experiences. She hadn't been able to share her experiences with anybody else. Care for physical health problems, and a befriending service to help with loneliness. Next slide, please. As I mentioned, we also talked with third sector organisations, and this is just some of the things that people told us talk to us about. So again, coming out of that theme around people were confused around how their health conditions related to shielding. So something around coordination of care as well was a strong theme. People felt perhaps that the GPs weren't linked in, and they maybe, and the hospitals as well, they weren't getting the information around their specific condition as they would have liked. And then also the theme around, again back to communication, but ensuring those communications understand that people we don't all have the same communication needs, and some people might need additional support to understand some of the messages around shielding. Next slide, please. So how do we use that information? So as I say, the weekly check-in, we produced a weekly report from that, and that sort of gained a real momentum in the city in terms of supporting health and care decision makers to get that real-time experience of people. So that report was distributed to over 90 health and care organisations and decision makers in Leeds. It was sent to key health and care planning groups to help them, such as Rachael's group, such as the Leeds Shielding Group. And because, and I will say this, because Rachael has done an amazing job in Leeds and absolutely understands the that all of this needs to be co-produced and people's voices need to be at the heart of this. She asked for the raw data, so we were able to share, because it's anonymous data, we were able to share the raw data, all the quotes, which really hopefully I think gave Rachael an insight into what that looked like. And Rachael, you might want to say a bit about that a bit later. Next slide, please. So as I say, since then we've continued to be hearing people all around different experiences in Leeds. We heard in September that shielders were less aware that GP services had been open, again really stressing the importance of like others have said, of health services not forgetting about shielders, and maybe some targeted communications to that group. Obviously shielders felt less safe from the virus in public than non-shielders. And 85% of shielders who were worried about going out in public said this was affecting how fit and healthy they felt, which again comes back to Anne's point around sort of physical health as well. Next slide, please. So at the moment we've got our weekly check-in is asking about mental health, and we've so far, I mean, I think we heard from about 600 people in about 3 days around mental health. Obviously mental health is something that's impacting all of us as a population, but particularly for people who are shielding at the moment. We heard from 78 people. Next slide, please. Over a third of people said COVID had had a negative impact on their mental health, and 59% some negative and some positive. Next slide, please. Over half said COVID had had a mix of positive and negative impacts on their mental health. Next slide, please. And I suppose some of this, I think that some of these themes are things that probably all of us as a general population would feel is incredibly intensely by the shielded population because of the experiences. So that reduced contact with friends and family is really, really significant. Next slide, please. The fact that access to physical activity, again, as Anne mentioned, that is particularly profound for shielding group. Next slide, please. And also for shielders, of course, that impact on household relationships as well. Another significant or another difference between the general population. Next slide, please. Next slide, please. I'll leave that one. And I'll leave that one, please. So just in closing, I particularly like to thank everybody who shared their experiences of shielding. The closing comments, particularly from the latest research, is that the pandemic has had at least some negative effects on most people's shielding's mental health. So we need to be prepared to support them around this issue over the long term. And those issues around isolation, physical health and household relationships have significantly impacted on shielding's people's mental health more negatively than non-shielders. And I suppose my last theme is just to absolutely drive home that message that any of this sort of planning needs to be co-produced with people with lived experience to enable us to make sure that we're getting the right interventions. But thanks Rachael.
Fantastic, thank you, Hannah. And I will say that it was just so important to have so many community organisations and groups, and particularly Healthwatch, to be in positions where they could hear from directly and really feed in those voices as much as possible, because something I say all the time, but these 102,000 people had nothing in common with each other, you know, the day before COVID, you know, and these conditions were announced. You know, it's not a group that's got, you know, a lobbying. It's not, you know, they're not people who know each other and work together already. And so it was so important that we had that, just that live, raw information as much as possible. And I think, as we've seen from the work that, you know, Professor Ann-Louise and Hannah and others have been able to do about collating those voices as well, to make sure that we understand both the individual impact, but also the trends and the things, because they are things that we can do things about and adjust. So thank you so much for that. I think the other myth I always like to bust as well is that, you know, that idea of that the shielding group are largely older. About, you know, about 50% of people are over 65, but about 50% are under 65. And particularly when we talk about our NHS workforce, our health and care workforce, I think we've underestimated as well the impact of people who are CEV also trying to contribute to the response to that, and I think that's why I was really keen for us to hear from John and Jenny about the work that they've particularly done around supporting the staff group of shielders who work for Leeds Community Healthcare. So I'll pass over to them now.
Okay, thank you, Rachel. And I'd just like to start by saying that it's a real honour to be here today, because this is one of the most vital and important conversations in our systems, really, and it needs to happen again and again all across our systems and services. And I work at Leeds Community Healthcare, which offers 56 services in Leeds and beyond. We have 3,000 staff employed at the Trust. And I'd like to talk a little bit about some of the work we've done with our staff who have been shielding, and also some of our staff as well who've been vulnerable, who don't fit into the CV category but are vulnerable because they've got health conditions as well. And in the next few minutes, I'll just talk about two things. I'll talk about the story of the work, but I'll also talk about some of the key principles which have emerged in the work. So I'll talk a little bit about the story of the work, and I'll do it from my own perspective, really. So I haven't been shielding, and the very early days of COVID, our director of nursing ran and still runs weekly clinical drop-ins where any staff can come and talk about how they are. And they became very, I mean, myself and one of the psychologists called Joe used to attend those weekly, and they became very powerful sessions where people were really sharing deeply how they were and how they were struggling. And in one of the very early sessions I attended, somebody shared their experience of working from home and shielding. And I was really struck by this, as was Joe, the psychologist. And we arranged to meet the colleague afterwards for a sort of one-to-one and online chat with them. And we began to meet and talk to more and more people who were shielding. And the question arose for us is, what sort of organisation do we need to be to work with these colleagues? And for me, I think there was a tremendous ignorance that I didn't realise these colleagues were in this position. And there was a tremendous impact hearing these stories. And one of the colleagues we met was an OT who offered to put on an online workshop for staff who were shielding to look at the issues of shielding and working from home. So we ran this workshop, and a number of staff came to the workshop. So we ran the workshop, and afterwards we had a discussion about, what do you need? What do you need from this organisation to support you? What matters to you, really? I think the conversation was, what can we do? And they said two things. They said, we need this. We need a group where we can work, we can meet, it can be a safe space for us, and we can meet and support each other through this awful pandemic. And the second thing they said was, we need you to be with us and to stand with us and to reflect back into the organisation, our stories and our messages. So what emerged in this group was two elements. First, of peer support, and secondly, being an expert reference group to help the organisation really hear and understand the issues and the struggles of our colleagues who were shielding. And that group's run now for several months. It's a fortnightly closed online group. It's owned by the staff. I do facilitate it, but it's totally over to them and their space. In between those fortnightly meetings, I act as the sort of link person in the organisation, which any colleague who is CEV or vulnerable can contact if there's any issues, and we will do our best to resolve and work through those issues, whatever they are. There's no boundaries on them. Actually, one of the most important things, and perhaps the most beautiful thing, is to see those staff who don't know each other but do now connect and work and support each other across the organisation. So it's had a real impact on staff, and staff have said this group has helped them through this, and it's helped them to sense, make, support, be with each other and find a real space for support and connection in the organisation. And I think reflecting on this, I think three principles have emerged in terms of the work. I think the first principle that's emerged is the power of stories and the power of storytelling and story hearing, and allowing those stories to touch us and change us, because that's often what really affects us. It's not other stuff, it's the stories, it's hearing human beings and thinking, what can I do? So the power of stories has been really key, and that links to our aspiration to be a listening organisation and a story-based organisation, an organisation that creates policy and decisions on the basis of what we're hearing from our staff and also the people we try to work with across the city. So the importance of stories, I think, is really key to the work. The second principle, I think, is the principle of self-organisation. And I think if we're honest about the wider health and care system across the country, this often doesn't show up. We often don't give away power. We tend to keep power and centralise it in many cases. And this is about giving away, in small ways, I think, but giving away power, resource and space that staff themselves can own. And that principle of self-organisation, I think, is so key to our systems. And there's lots of good data that says that if you do this, it works on every level, business levels as well as human levels. So there's something like that principle of staff owning spaces and supporting each other and finding their voice and their gifts in that space. And the third principle, I think, is the principle of community. And it's interesting because I think many times working in organisations, even in good organisations, it can be like being in a big organisational machine. And it's very easy to get lost in your head, lost in the work, running around doing this, that and the other. And the great challenge of that is it can depersonalise us and dehumanise us. And I think, as Connie said, this is about putting the human first and thinking about people. And I think there's a real need to create in our organisations these human spaces. And I think what we found in working with the Shielders group and working with these staff is what we have at the heart of an organisation is a little community, a little human community. And I think that's really, really key and really, really important. It's what we all need. We need that human connection and human community. And community happens where people find spaces to tell their stories. And I think that's what we've seen at Leeds Community Healthcare and what we want to spread in other areas as well. And there's a famous systems scholar called Margaret Wheatley. And a few years ago, Margaret wrote about how we live in a sea of disruption. And one of the great calls is to create islands of sanity in the sea of disruption. And I think it's very prescient given what we've been hit with COVID. We're no longer in a sea of disruption, we're in an ocean of COVID, an ocean of COVIDic disruption, really. And I think there's an absolute imperative in our services and systems to create and sustain these little islands of sanity and humanity, these islands of care and connection, which we all can do, and we all hopefully, I think, do and try to do. So the work's really been about that, allowing these staff to work together and be supported and heard and have a link to positional power in the organisation. And I'll end on this point really that this work can only flourish and fly if senior leaders support the work, trust staff, give power away and actually hear the stories themselves and be changed by those stories they hear. And I'm going to pass on to Jenny because Jenny works at a senior level of our organisation and Jenny's been a real model for exactly those principles really of trusting, hearing and standing with our staff who shield. So on that note, I'll pass over to Jenny.
Thank you, John, very, very much. And it's a real privilege to be here actually. And you know, speaking last, I feel at a bit of a disadvantage because I think there's been such brilliant stories and information shared. So thank you. So I'm Jenny Ellen. I job share the Director of Workforce role at Leeds Community and work very closely with John, of course. And what I would say is, I think health and well-being has been a huge focus for us as a trust this year, understandably. And akin to what others have said this morning, you know, the terms clinically extremely vulnerable, shielding, weren't in our parlance a year ago. And as you said, Rachael, that kind of connectivity of those thousands of people who are shielding across our region and our area just wasn't there the day before COVID. So we've had to really think about how we support staff in lots of different ways and rethink it. Actually, it has disrupted, this pandemic has disrupted everything. And what I would say about the approach at Leeds Community is that I think we had some good foundations. So our staff survey results are good, our staff engagement scores were good. The organisational culture is evolving. We were working on being inclusive, being people focused, putting our people before process. And I think that has all stood us in really good stead in terms of adopting the approaches we have done. Speaking to colleagues in other parts of the country, I think some of the challenges they've encountered about trying to support people has been tricky, really. And aligned with, you'll be pleased to hear there is alignment with what John said. I think that's really important, but aligned with what John said, I think there's the key things that we've tried to do in terms of supporting our shielding staff. So the first thing is, it's about putting people first. So really understanding where individuals are and what they need and how we can best support. And actually understanding that for many individuals, they're not just shielding, they're also caring for people. They might have caring responsibilities or children at home. They may be from a BAME background. There's all sorts of things that intersect here with that shielding experience. And one of the things that we find, and akin to what Annette said earlier on, is that our shielders are all working. So any that we employ are working, and that has proved to be, I think, quite important in terms of keeping them busy and occupied and having that purpose through this period. So that's been really important. The second thing is, we have tried through this period to better understand the needs of groups in our organisation. So as John's talked about the shielding group, we've also worked very closely with our BAME network. We've set up a men's health group. We have a caring group. We have a group for parents who are working with kids at home at the various points at which schools have been closed. And that's been really important to understand the experiences and to work with those groups on different things. So let me give you an example. The point at which we were looking at starting to vaccinate staff, we were able to go and talk to our clinically extremely vulnerable shielding group of staff and say, how do you feel about the vaccine? Do you have any concerns? How can we help you address those concerns? We think you're probably going to be first in terms of the groups to receive this vaccine. So if you need to go and have conversations with the experts who are caring for you medically, please go and do that. And one of the things that I've been really delighted about over the last few months is that one particular individual from the CEV group was the first member of staff at LCH to have the vaccine. And she did a little video and we launched that on our intranet and so on. And that was really great to see. We've listened and engaged, so hearing the stories, and everyone's reflected this, and I think it's so critical. So listening and engaging has been absolutely key, and I've been really struck by some of those individual stories, and as a leader, I think it's for me to carry those and to input that experience into the various conversations I have and to try and influence and change what we do. And I've been really struck by one particular individual story, and I've met with her several times, and she and I are working on a blog and the ability to kind of communicate in the organisation her experience as long as she's comfortable to do that. But she is a person who has been shielding for 10, 11 months now. She has a child at school the same age as one of my kids, so that's particularly struck me. And she had to shield from him in her house during the period that he was back at school. And that broke my heart, actually, hearing that story. And I've really carried that with me in terms of that understanding and using that type of experience. And I think we've also tried to take a holistic approach. So I have a member of staff in the HR team who's just embarking on her career. She's shielding, brilliant individual. She's been massively helpful on this agenda. But there's things like she needed a new laptop the other week, but couldn't go into the building in order to access it. So how could we support and what could we do as an organisation to work that out? And she wasn't the only individual impacted by that. So the very small things matter as well. And I think the more we can do to unlock and help with those very small things, the better. So I would just conclude, Rachel, because I'm aware of the time and I know we want to have a panel Q&A, by saying that I think my role as a leader in the organisation is to hear and listen and engage and use that information to, as Connie described it, fight for and represent this group and make sure that their voices are heard. I think that's really critical, and I've been enormously humbled by the experiences of these staff and also by the way the nation got on and continued to contribute really effectively to the organisation. So thank you, Rachel. I'll hand back to you.
Fantastic, thank you so much. And I think, as with all of these, I knew this was going to happen. I really want to hear so much more from all of you. But what I will say now is, Ryan, if you're okay to just allow anyone who wants to put their camera back on. It's always nice to see lots of faces. And we'll take some questions from the floor. Now, I've been tweeting and not been keeping as much eye on the chat. So if you put a question in the chat, by all means, draw my attention to it. But I'll start with Natasha, because I know she was wanting to ask a comment.
I am autistic and I have lots of health problems, and right from the first lockdown I felt very alone, very isolated. I've wished I could run away. I live in Harrogate, but I am under Jimmy's hospital as well, so my autism nurse is under Jimmy's and my pain psychologist is in Jimmy's, and my gastroenterologist doctor's in Jimmy's. And I just think that people who have got learning difficulties and autism, even throughout this, you've not even mentioned us. It's very, especially in the first lockdown, we weren't represented enough. We weren't even asked if we were okay. All we saw on telly was very negative things about do not resuscitate and everything. Nobody made sure we were okay. We had to fight for our rights. Those people who had social workers, the social workers weren't as helpful as what they could have been. I hardly see my social worker, and I could do with a lot more of seeing my social worker. And I just feel so isolated. I had to fight to be put on the extremely critically vulnerable list because I've got fibromyalgia, hypermobility, and then I was diagnosed with EDS, which is Heffernan-Daniel syndrome. And I just think that people, I'm saying this now, so everyone who's listening, please go and check on the people with learning difficulties and autism. Because we do need a bit more extra help. We are struggling the worst in this last lockdown, and we just need to know that you're there for us.
Thank you, Natasha. I think that's so important, and I think I will say, I know we haven't mentioned it so far in the session, but it is very, very, very front and center in our thoughts and planning. But like you say, it's really hard to make sure that we get that tailored to each and every person in the right way, and to reach out. And I think that's something that I'm going to echo is really important for us to hear. I don't know if Rob wants to mention, though, that we were talking about this issue just yesterday at our partnership.
Yeah, I had to fight, you see, even to get on the critically extremely vulnerable list. Yeah. And also I've now even got a COVID invitation to have my injection, but I'm also too petrified to have it because I've not got a learning disability, I've got a difficulty. They will automatically won't put in reasonable adjustments, but I still will panic and I can't be in a crowded place. And it's just things like that nobody takes into account.
Yeah.
So Natasha, I know that so on the specifics, I know that Leeds Hospital have done a lot of, if you're going for your jab at one of the Leeds hubs, they've done a lot of work with people with learning disability and autism, and they've got a lot of resources, and they will put in place, as all hubs do, specific spaces for people who might be more anxious or might need a bit more sort of care and support. So I would hope that you've got, you have a good experience, and please do look at some of the resources about explaining what will happen when you get there and how it's going to be for you. It doesn't matter if you've got learning disability, autism, or you're just anxious about vaccines, there are specific bits
I'm
of
sorry,
support.
I'm in North Yorkshire.
Okay.
I'm in North Yorkshire, I'm in Harrogate. So
Yeah, but so I think the Harrogate hub will be the same. And as you say, you're a really good example of why we're called West Yorkshire and Harrogate, because the Harrogate Hospital and the Leeds teaching hospitals work. A lot of people come from Harrogate into Leeds, and we work really closely with the Harrogate system. So I'm hoping that you have the right sort of support, but we can look at that. In terms
I'm sorry to interrupt you,
No, go
but
on.
I haven't. They're only offering me to have it at either Ripon Racecourse or the Yorkshire Showground, not even at the hospital.
Okay. Now those are run by staff who work from the hospital and from primary care, and are set up in a way which should support you. Now, if you got anxious about that, we can sort out afterwards for you to have a conversation with somebody.
Yeah, I am very.
Yeah, and I know a lot of people are, and honestly, the experiences that I've seen in the vaccination centres and the kindness and the care that's shown is really significant. So I would hope that you get all of the care and attention that you need personally. I think on the general points around learning disability and autism, I think you're right. You know, we've worked as a partnership over the last year to really focus on the messages and the support that might be needed for people, because there were some big mistakes made at the start, and you know, the National Institute for Clinical Excellence admitted that it got it wrong with one of its protocols, which was never actually used at all.
It was.
It did suggest that people learned.
It was.
It was no. It was a big mistake. It was never invoked. Now what we've got is, with the background of you know, the learning disability death reviews and their reports with mistakes by NICE, people are scared, and I'm not surprised. So we've got Bradford Talking Media giving us expert help and support into the partnership. This is people with a learning disability and autism. We've got a conversation just yesterday at the highest level about, are we really sure that we're doing all that we can in every situation for people who have autism or a learning disability, whether they go into the hospital, whether they go into the GP, whether they're having their vaccine, whether they're shielded. And do we want to make sure that we are advocating for early vaccinations for people with learning disability? And the answer to those questions was yes, because we must do that. Thanks.
That's my badge. I'm actually a self-advocate for learning difficulties and autism with Keyring here in North Yorkshire. So we do follow a lot of those topics up, and I also connect to learning disability England.
Yeah.
Thank you, Natasha. I think that's a really good example of exactly why we need to hear from as many people, as many different voices, and as many perspectives.
Well, thank you so much, and I'd be very grateful if I could stay on to have that chat afterwards.
Yeah, definitely. We'll follow up, because I've seen some really great resources, some really good videos of people with different conditions who have gone through the vaccination. So we can definitely share that, and we'll try and share it more widely as well to make sure it's available. So I am going to invite anybody, if you want to take yourself off mute or indicate in the chat that you'd like to ask a question.
Hi, my name is Michelle. I'd just like to ask a question around the vaccination for vulnerable people, because obviously they've been shielding, protecting themselves, isolating. The vaccination is very new, and I just wonder how confident people that have been shielding would feel about actually having it, because, you know, a lot of them have got very complicated health problems. I'm in a position at the minute where I have to make this decision for my daughter and feel extremely anxious about it. And I just like advice, really, and some support around doing the right thing for her.
Connie, do you want to address that?
Well, I can offer you my experience. I had my vaccination last week. I have rheumatoid arthritis and a long-standing lung condition called bronchiectasis. So for me, it was really, really important I have it. But my daughter, who lives with us and who I care for, has uncontrolled epilepsy. It's drug resistant. She has cognitive impairment. She has a long-standing eating disorder, depression, and a whole host of other things. She can't wait to have a vaccination, and I can't wait for her to have it. I'm that confident about it. And I'm so hopeful that when we have both have it and we've got to the point where the immunity is, is making a difference, where we can start to venture out, then that's going to be a way forward for us. I've always been really positive about the importance and the value of all vaccinations. So having this one to me is no different to considering when she had her vaccinations when she was a baby and a little girl. It's a very individual thing, and I do appreciate that, and I know you have to try to do the best for your own child that you care for. I can only tell you from my perspective that I was ready, willing, grateful to have it, and I can't wait for my daughter to be offered her invitation as well.
Thank you, Connie. I just feel like it's very much a very double-edged sword for me. I think as a carer, actually making a decision, a huge decision for somebody who doesn't have capacity to make that choice themselves, is a massive responsibility. And like my daughter has epilepsy and a number of very rare autoimmune problems that I don't know how that's going to actually, the impact that's going to have on her body. It's scary.
Yeah, no, it is. And I don't know if this will help or not, but one thing, because I've asked this question on behalf of other people who've raised that with me, is that as part of the vaccination process, so even, when you do arrive, there is a health assessment that questions that go through it, and that there are clinicians there and there are specialists on site, and if the clinician you're talking to doesn't feel confident about the condition that you've got or the rare conditions, they've got people on site who can pull in and do that. And even what's the beauty of the world that we live in now is that they can then also talk to people through video chat if they don't have someone on site and they're not confident. So I will say that I know it's about you making your decision up before you arrive there, but just to give you that extra bit of confidence. I think I saw Annette put her hand up. Annette.
Yes, in response to what Michelle's saying there, I totally empathise with what Michelle's saying, because for me, I was really worried because I have an autoimmune disease. I have lupus. I also have ankylosing spondylitis, which is a joint condition. But I was very worried as well because I have a history of having bad reactions to medication and so on over the years, and I've ended up in hospital because of bad reaction to medication. So I was really, really worried, but my fear of catching COVID was really also really worrying. So I decided to get some advice. So I rang specialist helpline from my consultant and spoke to someone, and then I contacted my GP and had a chat with them and asked them some questions that were bothering me about it as well, to get some reassurance. And I felt after that conversation, if I wasn't convinced, then I wouldn't go for it until I got some more advice. But I decided I would go and I would take that chance, because I felt that the risk of catching COVID for me would be greater. The consequences would be greater. So I decided to go for it. And then on the other side of it, my mum is a carer and my brother has autism and is deaf, and would not be able to have the vaccine because he has a fear of hospitals and medical procedures, and you wouldn't be able to get anywhere near him with a needle. But my mum felt it was important for her to have it. My mum's 80, so she had hers a few weeks ago, and I took her to have it and been monitoring her ever since, and she's been absolutely fine. But she was worried that if my brother caught it, because he's going out with carers, and brought it home to her, so it was she decided she would be best to have it, even though she knows he won't be able to have it at all. So it is an individual as individual as it can get, down to you deciding for yourself and getting as much advice as you possibly can, just to reassure yourself, because I totally understand how you feel.
Thank you so much.
Can I please add a little bit of an addendum to that as well? One of the things that I would always advise anybody asking this kind of a question, I'm a kidney transplant recipient, and there is always some kind of charity that is linked with your condition. So for example, for me, it's Kidney Care UK, and then there's the British Transplant Association or Society, and they usually have issued guidance around this kind of thing. So it's about being able to go and doing your own homework, and before you go, and having a look at the guidance that the charities or the societies related to the condition that you have issued. So that's where I've gone. I've asked my consultant. I've also gone to those particular places to look at the guidance around it. And then when I went for my vaccine, there was absolutely no problems. It was smooth sailing. And since I've had my vaccine, the only thing I felt is like I've been punched in the arm. That's it. So yeah.
Fantastic, thank you. And I think that the point Lydia made there, that peer support and that expertise in your own condition is so important. And I think one of the biggest things that people said to me when they first got their shielding letter was like, does this person know me? Do they know me? Do they know my conditions? And I think that has to be our ambition at all times. Everything has to be about me. You know, I always say there's nothing more personal to all of us than our health and care. And I think we have to keep up with that, even though we're trying to do everything as fast as we can and get as many people to be vaccinated and have that opportunity as possible. That's not at the cost or the expense of having that personal conversation and that personal decision. So I think they're really good examples, and particularly I think the support that's been offered by some of the organisational led, so the condition specific groups, has been phenomenal throughout this, and I know we've got some of them on the call here as well. I think I did get pointed to the fact that Malcolm Keelty from Disability Partnership Calderdale wanted to comment. Are you still with us, Malcolm?
He said he had to leave earlier.
Sorry, I apologize. I'm not keeping up with it. And I think Tracy, did you have a question about specialist cancer? Don't know, Tracy.
She may have left as well.
Oh, she's there. No, she's there.
No, I'm here. Can you hear me now?
I can, yes.
Yes, it was just asking which, I can't take my video off, it's fine. Which specialist cancer hospital, but when Anne showed the list of organisations, I think Western Park was on there, so I'm guessing that it was Western Park.
It was Western Park, but the specialist cancer hospital was the Christie in Manchester, because I used to work there, and their chief nurse is a former colleague of mine. We had Western Park, and we also recruited people with cancer through Macmillan Cancer Support, and unfortunately not many, because they were, because of their own internal workings, they were quite slow being able to get the survey shared. Which meant that we didn't recruit very many people through them, unfortunately. And also Anthony Nolan, and they had their own survey going on as well, so that they had a separate survey for their members. We had some interesting conversations though, and it's a piece of work we're thinking of doing around people who were towards the end of life. We didn't get very many people who participated through Western Park, and we think from conversations we've been having with them is that possibly people were making decisions because they were sort of heading towards the end of life that maybe they weren't going to shield, or they were kind of weighing up the risks of shielding versus the kind of the loss of contact with family members. We've not done that piece of work, but it is a piece of work that we have been chatting with Western Park and others, some of the other hospices, about possibly doing.
Well, we might be able to, if you need any help from the Cancer Alliance from that perspective, we'd be happy to help. Our patient panel have been really interested in the shielding issue and have fed lots of comments back into us. So I'll perhaps contact you separately.
Drop me an email, because it is a really important area, you know, of kind of you know, how how people make those individual decisions. And someone was asking before about the difference between the UK and other countries. A lot of other countries took more of a kind of a light touch approach. I mean, obviously shielding's never been mandatory. You know, the government's not sort of forced people in the houses and lock them in. It's always been, you make the choice. but it's been kind of very strongly recommended, and you've been getting the letters and there's been the central support. Whereas if you look at, say, Canada, it was a much more light touch kind of approach of, well, look, these are the things you want to think about, make your own decision.
Right.
You know, which has been a real contrast actually in the UK's approach. And I know something that central government's looking at as to, you know, if we had to do it again, will we do it the same?
Well, that's really helpful, and I'll contact you separately. Thank you.
Yeah, fantastic. I think there's so many connections, and I can see from the chat as well, there's lots of people who've been making connections. We are, however, at time, but I did want to give Rob a few minutes, just because as we've talked about connections, Rob is probably the best connected man I know, because he works right across West Yorkshire, but he also has lots of roles with national government as well. So I just thought it'd be really helpful for us all to hear what he's heard and the things that he's going to take back from this session.
Thanks, Rachel. So first of all, I'd just like to say thank you for everybody's honesty. And, you know, I thought that the session was incredibly powerful. And I think powerful at 3 levels. So the personal level, I really sort of loved what Connie and Annette started us off with. You know, the contribution that you both make to your family and to society is huge. And Connie, as you said, you know, this is a marathon. I feel tired and I've hit the wall and I can see the end, but God, it's hard. And Annette, you know, you saying, don't forget how much contribution we make, you know, at this point. And that, you know, I'm a big fan of, you know, seeing people's potential and then not wasting it, which is kind of what the system does to people quite a lot. So I think that first big message is about, this is an individual thing, where you can look at you can create the circumstances where people's potential adds to the system and creates a sense of their own well-being. And doing that is about little things. So Connie, your story about receiving the text, you know, I know exactly where you're coming from. I know exactly where you're coming from with that. So this sense of connection, this sense of communication, the needs to support individuals was the first sort of big thing to take away. I think the second is organisational level. You know, as organisations, there are things that we can do to support people within the organisation who are all around us. And in Swift, you know, the trust that I run, we've got a saying that you bring your whole self to work. And sometimes you hide it because you don't want people to know, and sometimes you don't ask what's going on. But what's clear is you bring your whole self to work, and you've got your expertise, but you've got your burden. And what is it that we can do to harness that expertise and ease that burden? And I think the conversation between John and Jenny in terms of what they've done in LCH is a great example of how we recognise people have brought them the whole selves to work. If we bring people together, we get their expertise into the organisation, how it delivers care, but we also provide support to people to ease their burden. And they don't know it. They don't know they're giving each other peer support, but they are. And I think that's the beauty of these sort of self-organising principles. You get the expertise, but you also get the peer support. And then the third sort of level was at the system level, isn't it? What are we doing on the big things that matter? So how are people with learning disabilities and autism thought about in our system? How are we thinking about continuing to support people who are shielded and recognising that people who are clinically extremely vulnerable have potentially a bigger burden, but also have faster access to vaccines than people who are just classed as vulnerable or just have autism or run-of-the-mill asthma, if you like. And there's a burden there and an issue. So as a system, we've already been saying that, you know, yesterday we said that we would be lobbying for government to make access to the vaccine for people with learning disability quicker. Because if you've got Down syndrome, like my son does, then you're classed as clinically extremely vulnerable. So you'll get the vaccine in category 4. If you've got a different type of learning disability, you're in category 6. And actually there's arguments that you should be, you know, bringing the people up who are in level 6 with a learning disability, because we've seen the evidence, 6 times more likely to die from COVID. You know, we've seen the evidence, we know what the issues are. So I think what I've heard quite clearly is those personal stories, those organisational stories, those system issues need to continue to grapple the resources, harness the resources that we've got and point them at things that are going to make the biggest difference. Sometimes that's a small act of kindness. Sometimes it's making sure we've got a system that meets everyone's needs. And I think, I'm a fan of stories and evidence. And what we've had is fantastic stories and real evidence. So I don't care where people are coming from. If you want to have an argument with me about it, I can say, well, Connie told me this, Annette told me that. Jenny talked about this, John talked about that, but I can also say, and here's some stuff from Huddersfield Uni. And here's some stuff from the weekly update from Healthwatch Leeds, from real people right now, telling you exactly what's going on in their lives. So I'd just like to say thank you to all of you, really. Thanks to Huddersfield for doing the work for nothing, for example. I'm not joking, it matters. And thanks for what you're doing and how you've engaged, because I always say that our system belongs to the partners. Our partnership is made of the partners, and that's the councils, the NHS, the third sector, and the communities. It's for all of us, isn't it? And if it's not making a difference to us, then it's failing. So a huge amount of things that I've written down that I will take away, and I've been tweeting a lot of stuff as I've been going along. But be in no doubt that I will be your biggest advocate where I can. I work in an organisation who has a single mission, which is to help people fulfil their potential and live well. That's the conversation we've been having today. So thanks, everybody.
Thank you, Rob. That's amazing. And thank you so much to everyone. Thank you to the people who've been here listening and witnessing these stories, because I know you will also all go away and do important things with that.